So what we would try and do that we would conduct this session in three sort of I would say three sections. The first section is where I will tell you a story, and in the second section I will introduce you to different careers which are possible in healthcare, and I'll specifically talk about all those careers which are non-doctor careers, because obviously all of you are aware that in healthcare there is one flagship career that everyone knows, which is to become a doctor. So I will talk to you about all other possibilities beyond being a physician, beyond being a doctor or a surgeon. And in the third section, before the Q&A, I would also I would sort of set a little ambitious goal for all of you by showing you all the programs which are available in perhaps world's most celebrated university or institution dedicated to healthcare as a sector and at non-physician careers. So I repeat, first section, we'll talk about a story. In the second section, I'll introduce you to some of the careers which are possible in healthcare domain beyond being a doctor. Now, of course, the number of careers which are possible in healthcare sector beyond being a doctor are far too long, and therefore we would only be able to introduce you to a few of them. However, in the final section, I would introduce you to an institute which is perhaps the world's greatest and the most highly celebrated institute in healthcare domain. So let's begin with a little story, and for that, let me share my screen with you. So we're saying that in today's time, these are the terms that you usually hear. You hear about all of these people. You hear about epidemiologists, virologists, of course, doctors, nurses, healthcare workers, and vaccine scientists, and so on, because these are COVID times, and therefore you hear about them all the time. But what do these guys do? Let's talk about a story or hear a small story from me, and then we will relate how the roles that they play is important in a person's life. So here is the story of a boy from Jaipur. His name is Ajay, and this is what happened to him. So Ajay, like some of us, is a sport freak, and he happened to fall while playing football and broke one of his legs. Now, the ligament in his ankle tore open and got entangled with his bones, which is very complicated situation to be in, but not so unusual. When you have a fierce fall with certain amount of force, an injury of this type happens quite frequently. So the ankle ligament tore and got entangled with his bone, which basically means that a surgeon had to operate on him and then put things back in where they were supposed to be, and a natural healing process would follow. The interesting thing is that what happened after that. So this is what happened after that. He recovered in a few weeks' time and started playing more football. So what is there for us to know in this? What is the interesting story in this? Ajay, a boy from Jaipur, loves to play football. He fell, broke his legs. Reaches the doctor, goes for a surgery, recovers, and starts playing more football. So that's what happens to Ajay. So that's a short little quick story for you. The interesting thing is that in this process of Ajay's recovery from an injury to a surgery to finally being able to be back on the field, who all played a role? Take a look. The question is, who all helped Ajay recover and what all did they do? In fact, there was a team of people. It was not one person. One would guess that it was a surgeon who performed the surgery and Ajay was back on his feet. Or one would say, no, there were some medicines that was given to him after the surgery, which helped him recover faster. But take a look, actually, how many people at minimum were needed to get Ajay back on his feet. Look at this. This is a list of at least 24 people and some more. Anyway, let's look at these 24 one by one. The first one is obviously, you needed some doctors and surgeons. A house physician, a doctor who would have checked on Ajay first and would have recommended an X-ray or a surgery, and then a team of surgeons or a surgeon who would have performed the surgery. Of course, you need nurses to nurse him and assist the doctor in the process of surgery. You would have needed X-ray technicians to run an X-ray and finally look at his fracture and his bone condition and ligament condition. You would have needed a radiologist who would interpret that X-ray or an MRI or whatever scan that was performed on his leg to read that and convey the findings to a surgeon. You need a phlebotomist to draw blood samples from Ajay's arms so that some tests could be performed and one would be able to find out that what are the internal parameters of Ajay, as in how is his sugar levels, how is his other cholesterol levels and all other parameters, whether he is fit enough for surgery, and after surgery, how well he's responding to the treatment. One would have needed a lab technician to perform those tests, a pathologist to finally study and report those findings, a microbiologist to basically say whether there are any infections that Ajay is carrying as a result of his surgery or not. He would obviously need a pharmacist who would prescribe him medicines. A bioinformatics engineer would be needed who will look at the data that Ajay's test reports would generate and study on it and then report and aid the doctor in completing overall treatment. You would need a biomedical engineer because the hospital where Ajay is being treated must be having many equipments, and those equipment needs to be managed by a biomedical engineer. A biotech engineer would have been needed by the companies which produce those machines or produce those medicines which are being used in the treatment for Ajay. You would have needed a design engineer to basically design various other things that the doctor would have needed to aid the healing for Ajay, which included a certain amount of walking stick or anything that Ajay would have been given after the surgery. You would also need software programmers. In fact, software programmers have a massive role to play in the healthcare of today, in the modern healthcare, right from the diagnostic report to interpretation of that X-ray report to designing a pharmacy medicines, or finally managing the entire admission to treatment to check out for Ajay from the hospital. A software engineer is needed. Many software engineers are needed to sort of design all the systems that need to run to deliver healthcare services. You need HTML coders, guys who make websites where Ajay's parent would have first found out about the hospital and contacted them. You would need genetic counselors who would study Ajay's genes and design the best diet for him so that he recovers faster. Obviously, you need genetic scientists and healthcare statisticians who will study the genetic data and say what is right for Ajay and what is not. Obviously, gene scientists cannot work without data scientists. So data scientists would need to run algorithms across thousands and thousands of kids across the world to see which category Ajay falls in. You would need a nutritionist who will design the right diet plan for Ajay. You would need a physiotherapist who will design exercise programs for Ajay. You would possibly need a chiropractor who's going to design whether Ajay is recovering well, whether as a result of his surgery and eventual physiotherapy, is he walking with a limp? Is his posture correct? You would need a dentist to check on Ajay and see if as a result of surgical medicines that he has taken, has he developed certain amount of mouth ulcers or some infection, some secondary infection as they speak in his mouth. You need an optometrist to check whether as a result of advanced antibiotics that has been administered to Ajay, whether he's hearing well or does he need some amount of work there. Again, you need an audiologist and optometrist to check his vision, optometrist to check his vision, audiologist to check his hearing. So this is a small example to tell you that these are the people who might be directly required to help recover one person, our little friend Ajay from Jaipur. And all of this may not be employed directly by the hospital. Some of them may be employed by the various companies which supplied various items to the hospital which treated Ajay. And these are direct supports. Beyond these, there are some others as well. Who are those? Let's look at the support staff, or rather the support team. Like, in cricket, you only see the 11 players playing on the field, but there are a lot, and maybe a coach perhaps, but there's a huge battery of team which supports those 11 people and the coach. The masseurs, the physiotherapists, the dietitians, the exercise experts, the psychologists, the software programmers, so many people. So let's look at the support staff. I'll move to my next. Yeah, there's a little issue when I go into presentation mode, I can't move to the next slide. So I would move to the next slide and then move to presentation mode. So here you go. These are the support team of people. These people are not directly involved, as in you don't see them in the process of treatment, but they are extremely, extremely critical. For example, the polymer engineer, the person who works with the plastics and designs the various aids that Ajay would have used in the process of coming back to walking and eventually running. The 3D printing expert who would have sort of printed certain implants if Ajay would have needed them. The metallurgist who work on the technology which is useful for healthcare interventions, the nanotechnology engineers, the sanitation professionals, so on and so forth. I'm not going through the full list, but you could see that it ends with an MBA, someone like me, who would have studied business and not necessarily healthcare, because healthcare, every business purpose of every business rather is to help achieve the objective of its customers. So if you are a healthcare business, then the managers or leaders of that company has to ensure that it is achieving the objective of the customer. Now, if you are a healthcare CEO, if you're a hospital CEO, if you're the hospital manager, then your job is to ensure that you have delivered what your patient came for. So what did the patient came for? The patient came for getting his leg back in order so that Ajay could walk and run again and play football again. So as a business manager, your job is to ensure that all of that is delivered in the right manner so that Ajay walks out happily. At the same time, his parents do not have to pay a cost which is exorbitantly high. So all of that needs to be designed. All the employees need to be found who are required in the process of delivering this service at a price which is affordable. And of course, all these employees need to be happy and motivated to do their job. Some of them need special training. All of that needs to be organized. So the resources, the manpower, all the service guidelines needs to be followed in order to ensure that the customer or the patient, in this case, Ajay, receives this treatment. That's the job of the manager. So all of these ancillary careers, plus the other 24 that I showed you in the first, so 24 plus 13, that's 37. Out of 37, there is only one role, which is that of a doctor. So rest of the 36 people who helped Ajay recover in this process were not really doctors, but they were all healthcare professionals in some way or the other. So that's the small little example that this platform, via this platform, we are trying to tell you that healthcare is not just about becoming a doctor, it's also about becoming many other professionals who aid the process of healthcare delivery or healthcare service delivery. The first section that we wanted to cover is sort of done. And I would now pause for a few moments and ask if there are any questions with regard to the various careers that you heard as part of this sort of little story. I would like to answer them. And then I will talk to you about two institutes and the various programs that they have come up in healthcare domain and how interesting those programs are. That would take just a few minutes. But before that, a minute break. And do you have questions? Do you have any question about the different careers that I spoke about, or anything about Ajay's recovery? Yeah, I'll wait for a minute if there is a question. All right, I don't see many questions. Let me go back to sharing my screen and share with you two institutes. The first institute, something that all of you are very familiar to. This is, of course, our very own IIT Bombay. And I want to specifically mention this program to you because this program is for non-doctors, as in people who study the field of mathematics or statistics or perhaps engineering. Now, IIT Bombay announces a program in healthcare informatics for BTech. It's a dual degrees program. This is a very interesting program because this program teaches students how to use healthcare informatics to take better decisions. Application of AI and machine learning, artificial intelligence and machine learning, is already reached a crescendo when it comes to healthcare interventions. And going forward over the next 2 to 3 to 4 years, it is only expected to play a substantially large role. For example, in highly invasive surgeries of stomach or heart, we already see close to 75 to 80% surgeries being performed in a robotic surgical manner with small keyhole insertion made, and surgeries are performed by robots. And decisions are taken basis analytics that a mathematics or an engineer analyzes basis health data available from all over the world. That's the highest form of example. The smallest form of example would be that what happens to a lot of diabetics who change from rice to millet, and how is the response from all over the world. And if you see that data, analyze that data, you might be able to provide a simple intervention to all the diabetics around the world to just switch over from rice to millets, and that itself will impact their diabetes to 25 to 30% positively. Something like this could only be possible if the right amount of data analytic tools were available. Otherwise, it was just a simple guesswork of someone. And something like this, a simple example of using diet to treat a certain condition, the most advanced example being where robots are taking decisions or deciding what kind of surgery to perform. All of this entire continuum of studies is possible through this program. This is just an example to tell you that how many engineers, how many data scientists, mathematicians, commerce graduates, all of them can contribute to healthcare sector. It is not just for doctors. Doctors are the captains and they need a team. And all of these people together deliver the care which makes a change in a patient or a customer's life. Finally, I would like to introduce you to the Mayo Clinical College of Medicine and Sciences. This is perhaps the world's most highly celebrated college dedicated to healthcare, along with Johns Hopkins. Both, coincidentally, both are US-based universities, and these are highly celebrated healthcare bodies. I would now take you to the website of Mayo College and just show you what are the different careers that they're teaching people for. Take a look.
I think you need to reshare.
I need to reshare? Yeah.
Your browser
right. tab. I'll do that. Thank you. Can you see my screen now?
Yes.
Right. So this is the website of Mayo College, and if you go to this website, you go to academics and you find explore healthcare careers. You click on healthcare careers, and these are the different careers that open up. Now take a look. I'm typing by work type. I'm selecting by work type. Take a look. Now, the good thing about this website is, and it's my favorite website, whenever I speak to some young budding healthcare professionals, is to show them that what are the different careers possible and what's the average salary that one gets paid in these careers, and what is the kind of education that is required, how many years one has to prepare to get into healthcare. And not all of these are doctor roles. So for example, you see there is an athletic trainer, and that athletic trainer is a healthcare worker, and that individual makes about $50,000 US dollars. That's a good amount of money. That's like 40 lakhs a year. There is an audiologist who makes about $80,000. That's about 55, 60 lakhs a year. And all of these are non-doctors. Obviously, cardiovascular invasive specialist is a doctor, but then a perfusionist may not be a doctor. A dietitian is obviously a dietitian. So like that, if you explore this, is a huge list. And I will not go through the full list for you, but I would like to introduce you to this website. Please visit Mayo College's website. Take a look at the list of careers which are available. And if you get interested, then you might as well try some other colleges as well. I would encourage you to look at maybe something like Johns Hopkins, and together with these two websites of Mayo College and Johns Hopkins, you would have a list of at least 50 to 60 healthcare careers where maybe doctor or a physician is just one. And that will introduce you to a sea of career in healthcare. So it's not just about finding the right career in healthcare. It's also about how to go about those careers. Is the how question, which you may be able to find an answer to if you study these websites and look at these careers which are possible. These sites will also tell you that what you need to do to become one of those, as in what kind of education you need, what kind of attitude you need beyond the basic eligibility criteria and the entrance test and so on. By and large, this is what I wanted to tell you, that what does it take to deliver care to a patient in healthcare? And then how should one prepare for a career in healthcare basis what is available? One thing common to everyone in healthcare, right from a doctor to a manager, if you decide to have a career in healthcare, then you must have two things very, very important with you. And these are all attitudes. This is not really any skill per se. These are your personality types, or other attitudes, or the way of thinking which you must have to excel and succeed well in healthcare. The first one is to have great listening skills. Whatever you would like to do in life, you must have great listening skills. More applicable in healthcare, because in some medical schools, they teach that if you listen to your patients, 50% of the diagnosis is complete at that very moment itself. So therefore, listening skills, very important in any role that you play in healthcare. Number one. And number two, empathy. The word is empathy, not sympathy. The word is empathy. Go Google what empathy means if any of you have a doubt about that word. But you must have empathy built into your personality all the time. You should be a person who is highly empathetic towards other people and have strong listening skills. If you have these two with you already, welcome to healthcare. It's a great field. You really feel good about your job at the end of the day, and you generally have a good night's sleep in this profession. So welcome to my side of world, which is to aid the healthcare workers deliver good quality care. Thank you. I would now sort of request you that if you have any questions, please feel free. I'm happy to take them up. The ones that I can answer, I would. The ones that I can't, I will make a note and I'll figure out an answer from an expert and get it sent across to you via the platform that we are all speaking on.